currently have a staffing agency called the DMF Nursing Registry, and it's located in the Atlanta area. So recently, I have heard from a family where they have lost three family members from the nursing home. It so happens that these nursing homes are not in the same states. So I decided that I wanted to find out what is going on with our nursing homes. And so I found out recently that the Centers for Medicare and Medicaid Services, CMS, repealed the minimum staffing requirements for nursing home that participate in Medicare and Medicaid programs. The requirements were adopted in 2024 under the Biden administration and included specific hours of nursing care per patient. That requirements or those requirements were repealed under this administration, where on December 2nd, it was announced that the original replacements would give way to having less nursing care for our residents in the nursing home. And this is very concerning to me because when we take our loved ones to a nursing home, we anticipate that they're going to be cared for by nurses. Thus, the term nursing homes mean that the patients or the residents that's in these facilities, usually called the long-term care facilities or nursing homes, would be cared for by nurses on a 24-hour basis. Well, no longer will this be the case. I believe it has started already. 3 deaths back to back reported by a family just this last week, where their loved ones were living in a nursing home. 2 of them were living there for over 2 years, and another one was just placed in the nursing home because the illness got out of hand and they needed proper care. And so this family member was only there for 6 days and then she passed away. The death was not anticipated. And so I wanted to come on to encourage anyone out there that have loved ones in the nursing home that now is the time to, to get in there, to find out if your loved ones are being cared for. Are there nurses on site? How many nurses do they have there in a 24 hours? And I know this is impacted by anyone who relies on Medicare and Medicaid. So if you're a private pay person, you might not be in this situation. But I encourage you that you should call up your nursing home where your loved ones are and find out how is this change, or how are these changes affecting your loved ones in the nursing home. And so basically, under the Biden administration, the CMS requirements was for a minimum of 3.5 hours of nursing care. Now, per patient. Today, they will only be given 8 hours of nursing care in a 24 hours. So generally in a nursing home, you have 3 shifts. On each shift, which lasts for about an 8-hour period, you usually have a nurse or several nurses. Now you want to find out what is the difference. How has this changed now? How many nurses will be there? Will there be a nurse at night? Will there be a nurse on the evening shift? How many nurses, if there are, will be there? According to this administration, at least 1 nurse will be available for 24-hour period, and that's the director. The director is not usually on site, so you want to find out who will be there at night. Generally, when there's any emergencies happening in these facilities, I'm telling you, it usually happens at nights because there are less people working. So if there are just going to be limited amount of people now more than before, you probably want to inquire so that you can make a decision. Do you want your family to remain home? And probably get some personnel to take care of your loved ones within your home or within their home. And so I just, thought that this is a pertinent information that you or anyone that you may know that live in a nursing home may want to, get a hold of this information and see how you can also move with the change. At least we're going into the New Year's. I want to make sure that all our residents are, taken care of. I know my parents, before they are not living anymore, God rest their soul, I know that I wanted to make sure that they had the best possible care. So for whatever this is worth, your loved ones worth more than anyone do know. And so you want them to have the best care possible. And so I wish you all a happy new year as we roll into 2026. I pray that God will, his strength will rest on your loved ones and on you. And I want to also thank everyone who have supported my platform during these 7 months. God bless you. Continue to support me. I will be continuing my platform. I will be coming back to talk about business in the new year. As you know, I have a staffing agency. I'm a registered nurse. And one of the things that I want to do, I want to start talking about encouraging others who are interested in starting up your small business, to become an entrepreneur, that I can assist you with whatever knowledge that I have. And if you're a nurse out there, think about, starting up a possibly a nursing agency like I do, or a home health agency. It's going to be needed. Right now, there's a shortage of nurses, and there aren't enough nurses to go around. And that's one of the reasons that these changes have been made by the Centers for Medicare and Medicaid. God bless you. I wish you a happy new year, and I hope your Christmas was a great one. Take care.